First of all, on behalf of Flagler Counties and One Voice for Volusia, welcome to the 2021 Health and Human Services Summit. My name is Dale Schuberg, and I will be the moderator of this session. You have joined the session titled Safe Storage and Safe Disposal, Changing Availability to Impact Health. All participants will be muted during the session. There will be a Q&A time at the end of the session for you to pose questions. We will then call on you and allow you to unmute yourself. You may also submit questions during the training in the chat box, and we'll pose them to the trainer throughout the session and at the end of the session if time allows. Thank you to the sponsors who made this event possible: Advent Health, Career Source Flagler, Volusia, SMA Healthcare, Magellan Complete Care, Department of Children and Families, and the House Next Door. It is my pleasure to introduce your trainer for this session, Susan Pittman.
Good morning, everybody. Thanks for being here at the nice first opening session and training. We're super excited that you're here. And if you haven't already, if you see that SurveyMonkey link, if you would please cut and paste it and put it into your browser and take a quick 4-question SurveyMonkey pretest, that would be awesome. That's something, that's data that we need to collect according to our vendor. And we really, really appreciate you taking just, a minute and a half to do that. Okay, well, I'll keep moving. So thank you so much for engaging in that survey. And if you're not done, please finish it up. We really appreciate it. My slides not advance. There we go. So you are attending the Safe Storage and Safe Disposal of All Drugs and Medications training. It was created by the North Florida Polydrug Task Force, which is up in the North Florida region. Jacksonville is where it's based, but we also have some reach outside of Jacksonville, but that we're focused on Duval County. And it is being presented by Drug Free Duval. I'm Susan Pittman. I founded Drug Free Duval back in 2008 and have been just so honored and blessed to work in this space, and decided to retire in 2018. And the reins are in the extremely awesome and capable hands of the new executive director. She's not new, been here since, she was with us since 2009 and has been the executive director since 2018. Her name is Sally Finn. But I came back to support the group and to do some of the trainings and work and project and strategy stuff. So that's my role with the company. Sally's the boss and I'm thrilled to work for her. So we are a prevention coalition. We focus on helping people design behaviors that reduce their risk. So that's what we work on. We wanted to do a quick icebreaker. It is National Prevention Week, and we are talking about safe storage of all medications. So the 2 questions are: prescribed opioids fix pain, true or false? And there is no legal methamphetamine, true or false? So once again, if you'll just put your answers quickly into the chat box, please put, answer one time with both answers. So like true, true, false, false, true, false, whatever it is. What do you think? Getting some answers. Good job. Okay, well, the correct answers are false and false. But the story behind those answers are: with opioids mask pain, but they do nothing to cure whatever the source of the pain is. So it's really good to know the fact, but it's even better to know the reason behind the fact. And on the second one, no legal methamphetamine. And, it is always illegal to be used recreationally, but there are very restricted uses. It's a controlled substance, Control 2. There are restricted medical uses related to obesity, ADHD in both adults and children. And there's actually some limited additional use related to insomnia. But it's as you know, very addictive, and it's a very dangerous drug. Also, overdoses. I didn't know as much about methamphetamine because we've spent the last few years on opioids, as we all know, and it's a dreadful overdose. So, it's really important. This training, it's funny because this training is simple, but it's not easy. It's not rocket science, what we're going to talk about today, but to really implement these changes, first in your mindset and your attitude, and secondly, in your actions, it's going to take some commitment. So the training objectives today are why it matters. Why does it matter to you and to your community, and who is responsible, and ways to be responsible and accountable. Then the truth about drug sharing, and we're going to look at it from a little bit different angle than sometimes people do. And then just drug disposal itself, when, where, how, etc. So we're going to start with the why. There's medicine in a medicine cabinet, a whole lot of medicine in a medicine cabinet. I have an 86-year-old mama. Her medicine cabinet kind of looks like that. Well, here's one of the whys, because per the National Institute on Drug Abuse, about 80% of people who use heroin first misused prescription opioids. That's a piece of it. So people who start to use an illicit opioid often began using a prescription opioid off-label, right? But where did they get that opioid? Not necessarily prescribed to them, because more than half, 53.7%, almost 54% of people who misuse a prescription pain medication say they got it from a friend or a family member. But it's not just about opioids and opioid overdose. Per the NIH, antibiotics. I mean, you guys know about this. We're having all this kind of antibiotic resistance. So now we have people who get MRSA and die from MRSA because even in a hospital setting with IV antibiotics, their body can't fight it off because we've created these superbugs, as they call them. And the misuse of ADHD medications is rampant. It's rampant among teens. And misuse of these stimulants has been linked to cardiac arrest and stroke. Even though it's not a high, it has some really dangerous outcomes. And look at this, a recent study from Ohio State University reported 7 out of 10 college students who use these meds without a prescription say it's easy to obtain. Because guess what? They get it from their friends. So these are the whys. The whys are to protect our children. The whys are to keep our young people safe from developing early cardiac arrest and cardiac symptoms. And they're to keep our elderly from misusing accidentally, or a drug seeker from getting medication from somebody who is legally prescribed. The whys are across our community, across our age span, across our ethnicities, across our socioeconomic classes. But who's responsible? I say you say me, et cetera, et cetera. But here's the law. The law says that when you accept a prescription, you accept the responsibility of its prescribed use and storage. It's kind of one of those things like when you get, you sign your driver's license and there's that tiny little thing and it says that you will succumb to body tests to see if you are, legal to drive. And a lot of people don't realize that. And if you refuse a breath test or a blood test or whatever, in the case of an accident or something, you can actually lose your license just for refusing. And you haven't even been found guilty of having the substance in you because you violated your contract. So you have a contractual obligation when you get a prescription drug to take care of that drug, to use it as prescribed and to store it the way it's supposed to be stored. And commonly abused and potentially lethal drugs should always be stored, carefully, safely, away from children, et cetera, and stored with extreme caution. Opioids, benzodiazepines, if you have a prescribed methamphetamine, et cetera, et cetera. But all drugs should be taken seriously. There's an impact if somebody takes too much vitamin C. And I take a chewable vitamin C. It actually tastes pretty good. So I'm going to make sure that it's nowhere where my grandson can get it. At 2.5, he'd probably really like the flavor of that vitamin C. And if he ate 30 of them, it could cause issues. Accountability is a part of responsibility. So you have the responsibility. So how do you account for that responsibility? So, accountability is included in knowing what drugs and meds you even have, considering how and where they're stored, and being aware of discrepancies in your inventory, what you think you have, and then what you really have, right? So I wonder if you could honestly, right now, name every single medication that you have on hand, prescribed or over the counter. Because, even though I do this training, and like I said, that it's a simple training, but it's not easy, because I have to be very intentionally mindful to remember and to note and to consider ways that these three things that I am accountable. So here's some tips. We don't want to just say you have to do this. We want to give you some tips. The first one is keep all of your drugs in their original child-proof containers with labels intact. And of course, that is assuming that you have child-proof containers. Again, my mama's 86. So she has some arthritis. And so now her pharmacy gives her the option of childproof or not childproof so that she can open her medication. So it becomes incumbent on her even more to make sure that her medications are stored safely, right? But it's important. I recently was helping her with some of her medications, and I noticed that she had taken a large bottle, because she has one that she has to take a lot of, and she had taken it out of the labeled bottle and put it in a smaller container. And so when I went to help her, because I was helping her load her little pill things, and she said, no, get the one over there. And it was in an unlabeled medicine container. And so I took a few minutes and explained to her how important it was to keep it with a label and all that kind of stuff. It'd be very easy to get things confused and mixed up, even for her unintentionally. And certainly if anybody was, trying to drug seek, et cetera. So again, this is one of those little tiny things that maybe we don't think about. We do things for convenience that really can make us unaccountable. Locking. Now this says store medicine in a locked cabinet out of the reach of children and pets. So if, a lot of times we'll do this training for 30 or 40 or 50 people. And we typically have maybe one person that has access to a locked cabinet, because locked cabinets are expensive. I mean, especially if you purchase an actual locked medicine cabinet. Some people do choose to put their medications in like a lock box, maybe under their bed or a place like that. But what we want you to consider the idea of the locked cabinet or out of the reach of children and pets. Number one, the very number one thing is don't keep your medicine in the bathroom. Who goes in the bathroom with you? It's a place to kind of be alone, right? So because of that, we really, really encourage people, get your medicine out of the bathroom, all of it, your over-the-counter, your prescribed medication, etc. Make sure that wherever you choose to store it, it's a place where lots of people go, where at any given moment, someone else may walk in the room, somewhere like the kitchen. In my house, I chose my kitchen. I chose over the sink. I have a raised cabinet over the sink, so it's higher than the rest of the cabinets, and it's all on the very top shelf of that high cabinet. So I'm kind of short. I have to get on a step stool, stand on my sink, and open the cabinet, reach all the way to the very top to be able to get the medication and be able to see it. My husband's a foot taller than me, so he can do it just with the step stool, but he even has to get on the step stool. So the point is, if somebody walked in and one of my kids was standing on the sink, opening that cabinet where we keep medicine, it would be very obvious that they were somewhere they shouldn't be. And, so that's a way that's an example of a way that you can not use a lock to keep it away, but you can create a really good safety net for where you are storing medication. So store, lock. Last one is count. This is such an amazing concept and one that I never thought of. It's counting your meds, and you count them first when you receive them, and then intermittently while they're being used. Let me tell you a little story about why this is so important. I have a friend who had 3 kids, and one of them was very diagnostically ADHD, and the mom was super responsible and all this kind of stuff. Well, she did count the meds. And so one day her count was off, and she went to her middle son, who had actually just taken the SAT. And she said, did you take one of your brother's medications for ADHD? And he very nonchalantly said, well, yeah. And she said, you can't do that. Why did you do that? And he said, well, all my friends do. I mean, I wanted the same advantage taking the SAT that all my friends had. So I took the medication. That opened an awesome opportunity for this mom to sit down and really talk to her son about the risk of using medication that's, prescribed to someone else, et cetera. But she never would have known if she hadn't been counting those medications. And this kid is getting ready to go to college. And what did we read, or what did we just see about those Ohio State kids? 7 out of 10 are using ADHD medication off-label, prescribed to somebody else. So it's super important to count, even if it doesn't cause an overdose, even if it doesn't cause whatever. And there are often, not often, there are occasionally times, excuse me one sec, sorry, but there are occasionally times where you don't get the right number of pills to begin with. And it's real important that you notice that and that you're able to talk to the pharmacist about that immediately. So counting is always good. But now we're going to talk about drug sharing. And in a nutshell, it is not okay. It's never okay. Sharing prescription meds with friends and family is not only dangerous, it's illegal. But what is drug sharing defined as? Well, under Florida law, giving someone a pill that is not prescribed to them is a second-degree felony, up to 15 years in prison. And possessing a prescribed pill or a drug without a prescription is a third-degree felony, up to 5 years in prison. So, yeah, that's really shocking. And we don't know any police officers who run around and just try to nail people on this. Okay, this isn't what their goal is. It's the law for a reason. It's the law because medication prescribed to you that can be really helpful to you might be really harmful to somebody else in a gazillion ways. Even if it's just like my mom's, heart meds recently, for some reason, began to interact poorly with another medication. And she had a terrible fall and ended up getting a subdural hematoma. And that was actually with all her own prescriptions. But any kind of medication can offset your balance, and you need to allow a clinician to be engaged in that process. So I want to tell you, I want to confess to you, remember that mindset change and how this is simple but not easy. This is exactly the kind of thing I'm talking about. I have 4 children. And when something like strep throat would run through our house, the first one, of course, I took to the doctor and they did the swab and it tested positive. The second one I took. By the third one and the fourth one, I was really tired of going to the pediatrician's office. I was tired of taking off work. I was tired of paying copays. I knew my kids had it, they were passing it. So I might get another prescription for one of the first 2 that it wasn't quite gone and then share the pills. That is so wrong. I see now, this is like my personal mindset change. I understand the reasons I did that. I'm not admonishing myself. I get it. I'm a busy mom, et cetera, et cetera. But the reality is I was creating a culture in my home of drug sharing. So that same child that had no capacity to understand how my brain was thinking and the reality that the antibiotic, but remember the antibiotic resistance, which I absolutely could have been, part of that problem. But, it wasn't going to cause any kind of overdose in my child or things like that. I was doing it for good reasons, but good reasons are not right. The good reasons were not legal. They weren't good for my child, and they created a culture of drug sharing. So then when my child did go to high school or college and someone offered them a Ritalin to do well on a test, or a tramadol because they had a knee pain, or an oxycodone because they had a headache, the culture of drug sharing I created and I allowed to be there. So it's something that I actually have apologized to my children as they aged. We've definitely changed that mindset. We do not do that anymore. We just go to the doctor 4 times if we need to. So what we want to encourage you to think of is even 1 pill of drug sharing isn't worth it. It's not worth it. Now we're going to move to drug disposal. And when we talk about drug disposal, we've been talking a lot about the risks and somebody getting a medication that might cause a problem in their body or their part of their mind or their soul, et cetera, cause an overdose or, a bad outcome. But we also want you to think about our pets and the environment. So it's about people, it's about places, and it's about pets. So disposal 101 is the idea, oh, I finished taking my prescription, so it's time to get rid of them in a safe way. Proper disposal always ensures safety to both people, the community, and the environment. We have 3 disposal methods that we recommend currently, and they're drug drop boxes. Try to say that 10 times fast. Drug drop boxes, drug disposal bags, and take back initiatives. So we're going to look at each one just a little. In Duval County, we currently have 27 locations, which is amazing. When we started doing this, we had 0. We ended up getting our very first, and for a long time only, permanent drug drop box was downtown in our sheriff's office, which on the one hand, it stayed safe because it was, protected literally by a whole bunch of members of the JSO, the Jacksonville Sheriff's Office. But the bad news is there's some people that felt uncomfortable bringing their medications or drugs or whatever to that location. In addition, even it's technically in the lobby, which is open 24/7, but it's uncomfortable to go there at certain times of the day or night or weekends or whatever. So eventually, we really pushed for this to have a bunch of drug drop-off locations. And as you can see, we now have 27. But as fast as we do something like print a list or create a magnet or something that will advertise these locations, one will close and another will open. So we have found this exciting resource. It's safe.disposal/drug-disposal/. And you can put in your location and it'll find all the drug drop boxes that are close by, and it stays fairly current. I'm not saying it's 100% reliable, but I'd say it's 90% reliable. So you're going to find at least some, if not all, of the drug drop boxes in your area when you use that link. So we're super thrilled about that. The second thing that we want to talk about, which honestly is, if we want to create cultural change, we believe that this is the most important resource. These are disposal bags, and there are several on the market. They're prescription disposal bags, but you can also use any medication or drug. You can't put a sharp in there, like a needle or anything, but you could even put liquids and patches, like fentanyl patches or vitamin D patches, things like that. And the doTERRA brand is one that we just are cheering about. doTERRA has partnered with us in a big way with the Community Coalition Alliance, which is kind of the coalition of coalitions for us in a 23 county area. And so they have made an enormous investment in this area to try to help people create and achieve this mindset change. The idea that when I'm done with my medications, I'm going to dispose of them, and I'm going to dispose of them well. An example of what I'm talking about is, because some things you're supposed to take all of. If you have an antibiotic, you're supposed to take the whole thing. But if you have a cough and your physician gives you a cough medicine that maybe contains a little codeine, he may say, use this until your cough is gone, and he gives you 30 pills and you use 15. So you have 15 pills left. Well, we tend to go, well, I'm going to save the 15 for the next time I have a cough. We really want you to encourage you to change your mindset and not do that. Instead, open up one of these doTERRA bags and pour those 15 pills in. And get rid of them when you're done with the medication. It goes out of date. It can be misused by someone else. It can be accidentally misused by you. We forget what's in there or what it does. It can mix poorly with alcohol, all kinds of things. But so with the doTERRA disposal, and so the idea with, if you have disposal bags, is it just becomes part of your mantra, part of your life, part of the way that you handle your medications. So with the doTERRA bag, once the pills are introduced into the carbon contents of the bag, and you follow all the instructions, which are very simple, we'll go over the steps in just a minute, everything is neutralized. Like even if somebody somehow opened the bag back up and poured it down their throat, it's neutralized. It's not going to hurt them. It doesn't hurt the groundwater. It doesn't hurt a pet. If a pet chewed it open, it is completely neutralized, and it can be disposed of directly in the trash. So how it works, super simple. And the reason I'm going through this, I'll give you a big bonus at the end, but you open the pouch and you tear it open. You add water, there's a water line. There's a line that shows you how much water to add per bag. You shake it up. Well, I shake it up. I always shake it up. I don't know why. You don't even really have to. You just wait about 30 seconds and then you seal it and oh, it does say to shake on the third step. Sorry. And then you dispose of it in your trash can, just like any other piece of trash. So it's simple, it's convenient. There are many sizes of the bags. They range from, being able to take like 15 to 30 pills or 45 to 90 pills, 90 pills to more. And then there are even very large containers that employers can purchase and have a drug take back at their own office. Containers that will hold like 1,500 pills. And again, it will say holds X number of pills and X number of patches and this much liquid. So it's very, very clear on the instructions of the bag what is able to go into those bags. I want to give you the very good news. Right before this presentation, I reached out to Carrie Baird, who is the director of One Voice for Volusia, to see if she had bags available, these doTERRA bags available for you to receive free through the CCA, the Community Coalition Alliance relationship. And she does. They are available, and you can go to the One Voice for Volusia website and you will find safe storage, safe disposal. And there's a link at the bottom there's a short little article that basically goes over everything we're teaching here. And then you fill that out and I think they will mail them to you, but you could read clearly. If you're in the Volusia region, you have free doTERRA bags available to you. Yay! So thank you, Carrie, and thank you, Community Coalition Alliance. The third way to dispose of properly is take-back days. And the DEA usually sponsors 2 take-backs per year. I don't believe we had the October of 2020 because of COVID, but DEA did host a take-back on April 24th of 21. In Duval County, we collected almost 400 pounds of drugs, and there was only 1 location. We're still a little iffy because of COVID up there. But this is amazing. I mean, across our state, we collect tens of thousands of pounds through this effort every year. So it's really important. You can listen and hear ads for that and participate. Many sheriff's offices or local police departments are holding take-backs now. They're like, this is really a valuable thing for our community because we're getting unused medications out of people's medicine cabinets or counters or lock boxes or wherever they are, and we're getting them disposed of properly, which means we're decreasing availability so that illicit use is less likely to happen. So what we would ask you to do is just check your local billboards, listen for PSAs, public service announcements on radio or TV, etc., and watch for advertisements to see if your local police department or sheriff's offices are doing this. Okay, if nothing else, there is an alternative disposal. And I hate to even talk about this one because we feel like we're really expanding the good disposal methods, but I want you to look down at the bottom. I said in bold letters, underline, please note, disposal by way of this method is only recommended if nothing else is available. If there's no drop boxes, there's no take back days, and you can't get your hands on a reliable method, a disposal bag that's certified like doTERRA. So whatever you do, any of these things, it does not technically deactivate the drug. So the contents could still be lethal. They could be lethal to pets. They could be lethal to another human, or they could be, cause some groundwater issues, et cetera. And remember, we live in Florida and our aquifer is very, very close. But if you need to do this, this is how you do it. This time you are going to remove your personal information. Remember, when you're storing it, you do not remove your label, but this time you do remove the label as much as you can. If not, black it out with a Sharpie. Then you're going to open it, you add water to the pills, right? And then you add a non-toxic, unpalatable substance, something like used kitty litter, dirt, coffee grounds, used coffee grounds, not something that smells good and fresh, but something that's like yuck. Then once you've done that, you seal it back up so it's wet and it's got this yucky thing in there. Seal it up with duct tape, like make it where it's be really hard to get out. And then you put it in something else, some other container, an envelope that came in the mail, or if you have a small box, you got an Amazon delivery, etc., and then place it in the trash. So you are trying to make it virtually impossible for somebody to even know it's there. And if they do know it's there, it's really, really hard for them to get to. That's the goal. We always get this question, can I flush my unused prescriptions? And I'm going to tell you the state of Florida's site says absolutely not. And that's good, because in the state of Florida, we have an aquifer that is very close, like I just mentioned, to, our groundwater is drawn from an aquifer that is very close. And we have a limestone infrastructure in our state. So the ability for our water to become contaminated is extremely easy. And like here in Duval County, we have a company called Advanced Disposal that takes care of our landfills and stuff. And because people just toss their medications into the landfill via regular trash and haven't gotten this amazing training and or haven't had the mindset changed and made that simple but not easy change in their lives, we have some groundwater issues. And Advanced Disposal actually has to spend a good portion of money every year, which raises our rates, right? Raises our rates a little, to clean the groundwater, because the EPA, which is the Environmental Protection Agency, comes along, tests the water around the landfill and says, ooh, you have contamination. And some of that contamination is prescription meds and other medications. So in Florida, under no circumstances ever flush. You shouldn't anywhere at any time, but it's particularly important here in Florida. So we want you to always remember, this is what it boils down to. Count it, lock it, and drop it. Count those meds, lock them up however you possibly can. Crazy, obvious place, but way out of reach of any, rational ease, and drop it as soon as you're done in a drop box, a doTERRA bag, or at a take back day. And we really encourage you, please reach out to One Voice for Volusia. I'm sure that our moderator, Dale, can give you information about how to access the One Voice Volusia if you need it. And with that, we just want to leave you so that you will really consider adopting this mindset change. I know it's a small thing, you guys, but it's a small thing that can make a tremendous difference throughout our culture, our youth, our elderly, for health, for the health of our environment. This is such an important thing, because safe storage and disposal ensures that your prescriptions don't get into the wrong hands or the wrong environment. Do you guys have any questions or comments? It's a quiet bunch. We are going to move to the post-test. Oh, actually, sorry, that was my question slide. And if you have any desire for more information on any of this, and you don't really want to say it here and now, we totally get it. If you want some ideas about storing or whatever, then please reach out to Hannah at Drug Free Duval, or me, Susan at Drug Free Duval. There's a few more of us, but we will definitely respond to you quickly, and we really appreciate your time. This is the post-test. So as we said, our funder really asks us to make sure that people are understanding what we're teaching. So they want to make sure that, and it's a good check and balance for us. Have we adequately shared this information, or do we need to change our training? It's only 4 questions, super, super quick. So if you don't mind, and I think Hannah's going to go ahead and put that in the chat. Yeah, she put it in the chat box. Let's see. Oh, thank you, Tammy. There's the post-test. You were doing the same thing with your teen daughter. Get sinus infections. Yep. I totally understand why you would share. And I did too. And for me, it was so mind blowing to realize, and I understand, and you weren't hurting her or anything, but creating this culture that then my children might go to college and take somebody's, oxycodone. I didn't realize the example I was setting either. And don't beat yourself up. You have the opportunity to really make changes. Thank you, Lisa, that you're done with the post-test. Excellent. Done. Woohoo. And y'all don't forget to reach out to One Voice for Volusia. I wish I could put the link. Hannah, can you Google it really quick? One Voice for Volusia. You can, I think it's onfv.org. You guys are awesome. You see it or no? Ah, she did it. So there it is, that onevoiceforvolusia.org. And on the site, you will see their safe storage, safe disposal. It's a little, she sent me a link on my phone, but I don't know how to transfer it onto my computer while we're presenting. But it's an article about safe storage, safe disposal. And then toward the bottom, you can fill out a little request and receive free doTERRA bags. Woo-hoo-hoo! Thank you to both Volusia, thank you guys, and to doTERRA and Raleigh, Florida, who I think has supported us for this. Thank you, Lisa. Do you see that? That is the link directly to where you can actually put in your request for the bags. You guys, it's been such a pleasure, and I hope it was a good way to start your day at the summit. We are extremely appreciative. Thank you, Lisa. We're really appreciative of the opportunity, and working with our coalitions across the state has been really just super rewarding. We are super focused on helping people adopt things that they can do to create a safer world for themselves and their environment and their families. And, if each person does this little bit, we can really make a difference. So we just are so excited that you invested the time in this training, and go take that simple thing that isn't so easy and just one step at a time do it. So we just really encourage you to make the changes so that your home can be safe, and your kids can be safe, and your grandkids can be safe, and your dogs can be safe. So thank you.
All right, thank you, Susan. Thank you everyone for attending the session today. I'm now going to end this meeting. Please navigate back to our event platform at HOVA for the virtual event program and to join your next session. All right, thanks again, Susan. Great job.
Thanks, Dale.
Yep, have a good one.
You too.